So, KORO, what does the head of a turtle have in common with a missing penis? Genital shrinkage, the KORO epidemic. Someone I know was a victim of the KORO epidemic, and one or more of you must have come across the condition known as genital retraction syndrome as well. So Aminu is a young, newlywed man. His wife had just given birth to a newborn, bouncing baby boy about a week ago. And he heard the call to prayer while he was at home. So Aminu went to the mosque to pray, as usual. When he finished his prayers and he was sitting down, the young man sitting next to him, who had also finished his prayer, reached out to Aminu and brought out his hand to shake him, as it is customary, as it is traditional, after prayers in the mosque, to greet one another, in brotherhood. So Aminu kindly, he welcomed the hand, he shook him, they shook their hand, and then the man got up and left the mosque. Aminu too finished his prayers and he got up and he left the mosque as well. But as he was leaving the mosque, suddenly a strange feeling took over his body. He felt a tingling sensation running down his body. And then he felt also at the same time a strange sensation around his genitals, around his private area. And then it just suddenly struck him. That man that had shaken his hand in the mosque had done something terrible to him. He had stolen his privates. He had stolen his penis. Aminu raised the alarm, and everybody in the mosque and around the mosque environs rushed to him. Dr. Tajuddin, please remind me to tell you what happened to Aminu at the end of this interview. I want all the viewers to learn what happened to Aminu, and that will help you in understanding this topic, the KORO phenomenon. So this West African genital shrinking epidemic called KORO, has been documented as far back in Nigeria as the 1970s. But in 1997, Nigeria and Cameroon had a resurgence of this epidemic, and it spread widely across, West Africa. It extended to Ghana, Ivory Coast, Senegal. KORO in Chinese is known as Shukyang or Shukyong or Suoyang, and it just means shrinkage of the penis. And today we have Dr. Tajuddin Abiola. He's a consultant mental health physician. He's a neuropsychiatrist, and he is going to reveal the truth about all those curious disappearances of missing manhoods you've been hearing about over the last few years. I mean, we're seeing more and more of men on the streets holding onto their genitalia, either openly or discreetly, with their hands in their pockets, holding onto dear life, so to speak. Women can also be seen holding onto their breasts discreetly or even directly by crossing their hands across their chest when they're walking on the streets. Hello, I'm Dr. Hadiza Tijani Suleiman. I'm a consultant plastic surgeon, and I'm here today with Dr. Tajuddin Abiola, as I mentioned before, and we're going to talk about KORO, the epidemic genital retraction syndrome. So, Dr. Tajuddin Abiola, you're welcome.
Thank you very much for having me.
So how do we even pronounce this? You're welcome. How do we even pronounce this terminology, KORO? Is it KORO? Is it KORO? Is it KORO? How do we pronounce it, really? And then what is it?
Well, the pronunciation, I may not be able to tell you whether I got it right or not, because like you have rightly pointed out, it's a foreign terminology to us locally here. But often, we often refer to it as what's called KORO. KORO is one of those things that we learn in mental health, understanding of bodily manifestation of some mental distress that people might be going through. One of such manifestation, uh, especially when there is high situation of stress that individual are experiencing, is KORO. And KORO, like you have said, that it's a syndrome that will classify as culture bound because they are defined based on culture. Uh, so most of the other study are culturally sensitive to areas where those things are typically found. And it is also based on widespread belief in that particular culture that such phenomena can occur. And like you rightly said, uh, the individual you described, the story usually typically goes like that. That individual who have the genitalia, in the case of male, the penis, and in the case of female, the breast, or typically the nipples, in the case of female. And so that is usually one of the things that should be present. And now suddenly the individual felt after a strange encounter with a fellow human being, with another individual. And when that encounter occurs, the individual feels like you described the head of the tortoise, retracting back into the shell. The individual felt like the genitalia have retracted or disappeared in the way they may put it. And that based on the cultural interpretation in that particular context, then we can give it whether they say it's disappear or somebody have stolen it or it has been spiritually used for one rituals or the other or supernatural phenomena to explain it. And when that do occur, that further increase or worsen the distress that the individual is under. And so typically KORO exists in this context. So it is a kind of, we can describe that it's one of those disease condition that is telling us about a, an underlying major distress, say psychological distress that the individual is going through, and now is manifesting in a way that the individual attributes to what contribute to that individual masculinity or femininity. So
So is
what
this
contributes to
happening?
that?
Yeah, so is this happening in other countries other than Nigeria? Because I mean, some people
Yes,
might think
like
it's only
you,
happening in Nigeria. It's happening in other countries other
yeah,
than
yes,
Nigeria.
it does happen. Just like you rightly pointed out that you have talked about the Asian subcontinent. You have mentioned about the terminology used for it by the Chinese, which is one of where it is what we first described. But also, it does happen also in our own experience in Africa. There have been reports from South Africa, other West African countries, including Nigeria, East Africa. There are pockets of description of similar phenomenon. But what all this stuff is that there is a cultural belief that is there, and this overwhelming cultural believe that individuals have been attacked in supernatural way, in
Yes.
esoteric way, and that's believe that when the individual's very vital organ that the individual associates with his masculinity or femininity disappears, there is signals that the individual is going to experience imminent death soon. And that is why it is that overwhelming more addition that the individual is going to experience, that imminent death, that threatening death looming on the individual that brings the world body more and people can go berserk on it. And based on the cultural milieu, people that come around also further contribute to the already charged situation. And that can make innocent individuals to be punished and can also worsen the individual that going either to get relief from it on time or it can delay the recovery period for people at times. So
Yes. In
this is
fact,
essence I can describe.
yes. And there have even been cases of people being lynched, isn't it? People that were
Exactly.
accused of
Exactly.
stealing the penis or the private organ of the individual being lynched, being mobbed,
Yes.
and, and
Exactly.
killed or even severely harmed.
That's very true.
Yes. So, Dr. Tajuddin, please, what have been some of your experiences with epidemic genital retraction syndrome or KORO within your field of psychiatry? I mean, from your training up till present now as a specialist. Can you just talk briefly about some of your experiences with some of the patients that you have managed or you have seen being managed when you were a
Uh,
student?
it might surprise you that we hardly see such people present to our facilities for mental health needs or for mental health help. For the simple reason that when this happen, it just become a social phenomenon mainly that raise a lot of media coverage, and everything fizzles out from there because people either get jungle justice or accept fate, and everything seems to recover to turn back to normal. And at times, some people have make self confessions in a way that yes, they steal people pennies, they pay somebody pay them to do. There are many things that go on, but what we know from the scientific viewpoint is that that is not the case. But like I said, when something of occur more in a social experience, people don't tend to understand that there may be a medical reasons to present to the hospital. Further was is that to even present not only to the hospital, to a mental health facility, where the individual most likely might have a better understanding of what are the background issues that could have gingered up this distressful bodily manifestation of what the underlying background psychological suffering the person is going through. So they hardly present, but however, it's of interest to us because when they do present, we have a lot of many ways to help them to overcome this. So I can just cite from you from literatures and also talk about some of the documented cases that do present, especially to teaching hospital, when finally they were psychiatrists were invited to come to it. I may talk about something that looks similar to KORO, but not entirely KORO that I've experienced too, that might have come to me. Historically, the concept of KORO from a well documented this thing can go on for years in individuals. And there will be people like that who believe that they experience KORO, and that is why they cannot uh, get married. And the story is that the individual live for over 20 years while still going on with this condition with them based on the cultural beliefs and that. Also, there have been charged situations, especially when there is high economic problem, what we call the economic distress in the community. And like the joke says that people going through economic stress are going through a lot of psychological burdens too as well. So it's not just only the economic loss or the economic difficulty they are going through. The economic difficulty is further recoloring their psychological interpretations. Is other further depleting the coping mechanisms. I mean, their coping reserves that they have. And when all these things match together with other psychological phenomena that they cannot describe, this further put the burden on them. And now, when the situation is charged, then instead of understanding what the background is, it manifests in this bodily experience. The individual suddenly feel like you described the case of Amino, a sudden tingling sensation that later centered on his genitalia. And maybe, I don't know, maybe all hell was let loose and everything came crashing down. But you have described the story that is typical for people that experience that. I remember one of such case that my teachers taught us about the experience in the University College Hospital Ibadan, where the individual suddenly was brought to the hospital. He tied his genitalia with a rope and he was dragging it that no, this is retracting and they have to do something to let it, because if it goes in, it's going to die. That something must be done. He cannot allow this to go inside because if it enters his body, it's going to disappear into his body and it's going to cause bodily harm. But of course, after treating the individual with some anxiolytics and the individual was able to have some rest, the individual recover, and then some underlying social burden that the person is going through were discovered, and this were looked into. Like I said, my own experience then was I was called once to the accident and emergency unit to come and see a young man, and he's in a relationship. They are talking about marriage. They even fix a date, and suddenly the lady person called it off and the individual collapsed. And when it was brought, one of the most represented symptom is his genitalia be shrinking. And I feel that this incident, the lady has used his genitalia, and now it's shrinking and it's disappearing. And it took a lot of psychological intervention and with some medication to help the individual to start so that he can process what happened to him or her, because the individual doesn't want to process that experience. That ideally, I'm the man, I'm the one who should call it off. Why should we the lady that call it off? And that experience made him to start having this. So his masculinity in quotes has been challenged, and that's bring that to the individual. So they do occur, but it's once in a while that they do come. And when they come, that's when they may get even a better understanding of what is happening to themselves and what they can do about it. But like I do said, it's not only in men, although it's much more common in men compared to the woman, the ladies. Yes,
Yes.
but the thing is too, if they are going through similar stressors, that do occur where the nipple be trapped inside, and that becomes a body because that's association that what represents my femininity or masculinity is affected. It seems to be exposed, and everybody will now say, okay, I'm no longer what I claim to be in terms of gender wise. Then the individual felt that it's a threat to life, it's a threat to that balance of identity that they are associated with, and that
Yes.
immediate fear that they are going to die associated with it based on cultural beliefs push them under that heavy distress, heavy suffering that they go through.
So, how prevalent is epidemic genital retraction syndrome or KORO in Nigeria? And where are there any specific areas in Nigeria that have been affected more by KORO than in other areas in Nigeria? Is there any specific prevalence rate in Nigeria? Has there been any study carried out?
Like I just said, what I'm aware of are just case reports that they have not been well documented. Because if they do present to the hospital, we might have some hospital data more to present, but from case reports, from those that trickle in. But what I might talk about are usually media reports and the media frenzy that do occur. And the period that this usually typically occur are period of high economic distress that people are going through. And also, it might also be during high political distress that people are going through, high political distress. Because whether we like it or not, politics is such a big event that might at times bring a lot of people to gather in a very closed, tiny space. Yes, they might be large outside, but a lot of people gather there at once, and that can bring a sense of distress that they may not be able to put at it. So often, these two phenomena seems to play together, where people expectation of how they want the political events to go did not go that way. And there are a lot gathering of people, this experience might come up. Or when a lot of economic distress is there in the community, like there's economic depression. Let me put it, economic depression is really there. So this may
Yes,
also
social political change.
changes, yes,
Yes.
that everybody knows there. So this may also contribute to it. And like in the case of family, the one you described, there may also be other stressors that may be there. Of course, like we do know, pregnancy is a thing of joy, but it does come with its, apart from physiological changes, natural changes that we know do come with its own distress that it come with, but it may also bring its own challenge for the partner, for the husband. And during delivery, the husband too can go through his own form of delivery, which is referred to as COVID syndrome, which I'm sure you're familiar with. And that may also worsen if the husband have not gotten over that distress. And now there may be other things that may have challenging. The wife gave birth and he may not have intimacy with the wife for some time. So, and that may also worsen and look and feel, oh, now that I can't have access to my wife, I can't have intimacy, and now I fit this sudden change. Oh, could it be related to the innocent man that created him in the name of peace, and now everything has gone berserk this way? So many things can happen, and different kind of stressors might bring it up. But one thing we know is that usually overwhelming stress that this is
Yes.
associated with.
Yes. In fact, while I was reading for this interview, I even came across the fact that people that abuse drugs, also tend to have a KORO syndrome. And so I was now thinking that, okay, maybe because, right nowadays we have a lot of youth that are involved in drug abuse. Could that also be one of the main stressors, apart from, of course, the social political tension in the country? Could that also be an added stressor that has led to the
Yeah,
in the first place? And then maybe that is why we're having this trend, you know. But
um,
is there anything like a seasonal variation, or should I say regional variation, would you say?
to look at it, yes, substance use often are used by those individuals to try to cope with that distress they are going through. Because it's the wrong way to cope when somebody is going through psychological suffering. Substance of abuse will not relieve those suffering. It will mask it and bring up a misinterpretation, giving them a uh, misunderstanding that what they are doing is bringing relief, but rather is masking it. Whereas the main trouble is still underlying and it's going nowhere. It can even worsen the trouble. And that's why it might be look at, okay, maybe people who are using it are experiencing KORO as a result. But that experience might actually be related to that background stress. The substance is just a face cover for that, trying to use it to, to treat that distress. But knowing substance for what it is, it will also it might worsen that psychological suffering, because drug of abuse is not designed to use or to be utilized as a means to help people to cope with that psychological suffering they're going through. So often it comes with its own problem, and now the individual might have multiple psychological problem at the same time. There's substances on its own, and there's other problem that have been there as background. So all these come together might worsen the situation, and the experience of KORO might come in. So on its own, primarily, substance of it might not be. But because substance of it can alter how individual think and perceive situation, they can make a claim for that. Then also in terms of regional variation or manifestation, like I said, there's no data for me to be able to speak on that. But what we know is that this kind of phenomenon seems to be more prevalent in major cities, in those areas in where it has been reported. In major city where the city itself is stressful, so the stress in the major cities are there, and people trying to cope with the stress in the major cities, trying to survive there. So the multiple layer of different distress they are going through. So those psychological suffering, often bring this up, but that they may be seasonal, but often are related more to during electionary period, because there are election anxieties, and people at times look at it that, okay, the way or the anticipation of how they are looking for the election outcome, if it doesn't go that way, and they already have, so it might also worsen their psychological state of suffering, and that might also contribute to that. So, but most of what has happened in recent time in our experience are usually related to electionary period. Also, there are also period of festivities where people believe that, oh, everybody wants to celebrate, and now that if any strange feeling happen to them because of their own high anticipation of, they don't know how this festival period is going to be, they have been looking for resources and it's just not there to look at to celebrate it. And now other people might come, and so that anticipation, so that period I usually look at, apart from electionary festivity period, major festivities are also associated with this, where a lot of people are trying to see how they have high anticipation, but there may be little means resources to live up to that or to meet that. Not only people who have the little resources, people who don't have it too, because of the cultural milieu, the superstition that permeates in the community, also made them to believe that those such can happen. And if those do happen, they can also form victim of this.
Yes. So we can say that people that are more prone to developing KORO have some form of anxiety disorder, and many times, isn't it? They have some form of anxiety disorder, probably running in the family.
Uh, I might not be specific now, because I know there can be anxiety attacks because of that. But because anxiety as a disorder, there are many different forms of anxiety disorders, which because that's why they are the commonest psychological problem that people do experience. So until the individuals meet an expert and is able to decipher that this is the particular type of anxiety disorder that the person may have. But I may look at it that there may be moderate to severe anxiety attacks at that particular point in time. But often there are background psychological sufferings, the background psychological burdens that the individual is, but the baggages that the person is carrying. And in the midst of all this, then this might be one of the manifestation, bodily manifestation of that anxiety attacks or worries or fears that the individual carries around as a baggage with him or her.
So has there been any difference that has been noticed? Are there any differences, the ratio of, females to males having KORO syndrome? And then, sorry, you mentioned that already. The issue of singles and married. Has there been any study to show that, okay, fine, single people tend to have more of KORO syndrome than the married or vice versa? Have you come across that in your practice or in the literature?
I have not come across that there may be a gender interpretation to it, but that's a sex related interpretation to it. But most of what has been described are usually those that come as epidemics, like what I've tried to describe. It's not. It can occur as sporadic, but it's not something that occur typically like that. And most of what that have been documented are more in males than females. And so I would not say it's not there. It's just that we don't have research to be able to tell which of the sex, the gender might be experiencing. Is it the male or the female that might be experiencing this more? But the evidence are there, and often there may be comorbid challenge that are there. Like I said, there are background psychological suffering. So it might not be anxiety related, it might be depression. For some, it might be psychosis, and different form of the manifestation of all this can be background to all this. But to say that which gender might carry the highest body, I don't have data to be able to support that yet. But most of the case reports have been that of male that have been documented more compared to the female.
The females. Yeah, so I know that, okay, fine. As physicians, we know that there are some medical conditions that can actually cause a retraction of the penis. So as practitioners now, in the public space, how are we able to differentiate easily KORO from other conditions that can also cause a retraction of the penis? Because I know that there are many conditions that can cause retraction of the penis. Sometimes if it's excessively cold, sometimes if the man has a very full mons pubis, who has maybe a lot of fat in the mons pubis. Sometimes conditions like Peyronie's disease and many other medical conditions can cause retraction of the penis. So how do we easily differentiate as physicians when patients are brought to us, the retraction being as a result of those medical conditions or as a result or ruling out KORO as a cause of that retraction of the penis?
Yeah, thank you very much. Like everything, we always talk about differentials in medicine, and you bring up some of those differentials that are possible. But the thing that is unique in terms of KORO is all others we have that specific way to describe them, because you can be find that there will be those physical features that can show that the underlying or background physical illness, or just physical features of obesity and things like that may be related. But often, when it comes to KORO, or what you may call the missing penis syndrome, or in some instances, or the genital retraction syndrome, better described that as the genital retraction syndrome, that when it comes to that, most of the time you'll be able to find that background psychological distress. And also the presentation are also dramatic. The presentation comes in dramatic way. So it's not something that the individual is gradually going to it that may occur in some of those physical illnesses that may come or other challenges that may come up. But often, most of them come in dramatic way, and the drama is not missing. Most of the time, one cannot miss that drama when it occurs. So that may be one of the features that may show how KORO might present as different from other syndrome or medical condition or even normal experience that may be associated with genital retraction. And like you did rightly point out that the condition, that means the weather condition, whether it is cold or hot or humid, can also have its role to play, because they can have roles to play when it comes to the genitalia, especially for the male. So,
Yes.
and the female too in some instances. So that do plays role there too, and it does add to why the physician, if he's seeing any individual in this, to have an open mind and to do due diligence to call the next to see that he did collect the necessary information, get the right history, and all these will come together to be able to help the person better in trying to understand that. So, but koro are usually dramatic because they follow such drama, just like we described the story of Adamu, or the story of Aminu. So that drama is usually there, and the way it presents shows is usually in a pensive mode, and so that do bring this to the fore, because it's not something that the individual might even be aware that they know they are going through suffering, but they can't put a voice to it. Unlike the physical illness, that there will be physical manifestation, facies of it, and things like that. And maybe in the weather condition, those some have also showed that, oh, it's as a result of this that is going on. So this, I may say, should be a guide.
Yes. Some of the symptoms that you mentioned of Koro syndrome, I also read about other symptoms which one might even find to be strange. Some of them have diarrhea, some of them have vomiting episodes, some of them have abdominal pain, as I read. So I found that to be so interesting. And as you mentioned, in an attempt to try and prevent the retraction of the penis into the body, they tie ropes and they pull, sometimes even being aided by people to prevent the retraction. So I found
Exactly.
that quite interesting. So I was just wondering whether here in Nigeria we also tend to see those same symptoms too. That I mean, I just mentioned, like the abdominal symptoms, and then some dizziness, sometimes some dizziness. Some might even faint. Some might lose consciousness. Do we see those same symptoms that are documented in the literature here in the country?
Yes, you are very right. They are present there too. But because of the drama that surround it, they don't complain of that. It is when they are presented, and now you cannot be asking, at that point in time, do you feel this? Say, yes, I was feeling this too at that point in time. But that drama, the typical social drama that we do witness, and the things that you are responsible, I'm not responsible, and all those interchange overwhelm all other features that they do have. But it is because all these are going on that continuing to bring that sense of imminent danger that the person is feeling can also contribute to why, as a after effect of what they've claimed, and the associated imminent feeling of dying, that may now bring some of these other features that may not be there, like pensive breathing, like the changes in the body, abdominal pains, diarrhea. All this may come because they are when the individual is under another form of anxiety-related phenomenon and anxiety
Yes.
manifestation of suffering. So all those things can explain this better.
Yes. So it's interesting. It's quite an interesting topic. We've viewed the various cultural contexts of Koro or epidemic genital retraction syndrome. We have talked about some of those insights between stress and its onset. We talked about some of the triggers or stressors that tend to exacerbate Koro or epidemic genital retraction syndrome. We've talked about the issue of when there's a high rate of drug abuse and social political tension, which is more rife. So, Dr. Tajuddin, please, can you
Yes.
talk about some of the primary treatment approaches for KORO or epidemic genital retraction syndrome. And I mean, how effective are they really, these approaches?
Uh, Thank you very much. In as much as I've tried to bring this to the fore, one of the foremost thing that is there is that the individual presenting will be encouraged to go through some relief, and without using uh, those techniques that can bring relief to the individual immediately, that it might make all the efforts to help the individual to be further delayed and to worsen the experience that the individual might be having. So it is those that is very helpful that one needs to be extra cautious in the approach. And one of the things that will be helpful is that for the individual that is supposed to provide the help, he also needs to learn some other technique. But generally, I would expect that if the individual is a medical expert, at least one of the things that we typically do is to be able to provide means to chemically bring relief to people. And one of the things that's usually done that when people come in that, and have you done the due diligence to be sure that there's not a physical illness that when we do provide these hypnosedatives parenterally to bring relief, that the individual will not be further in more danger. Then these are one of the things that are typically used to bring relief to individuals that are going
Okay, you
through
mean like
that
in
pain.
form of medication, medication or like psychotherapy?
Initially, depending on how dramatic the individual presents. So, giving a parenteral hypnosedative will help to calm the individual down. Then, psychotherapy might follow, depending on the interaction that have taken place. Because, like you do agree, if it's a physical uh, injury, let's say the individual have a road traffic accident, there are telltale signs that the doctors go through, like the ABC that we do look that when somebody's having a physical trauma. So this
Okay,
is
yes.
like a psychological trauma. But when the individual come in, we go through all those process of the trying like the physical trauma to be sure that the individual will not have an actual physical illness in the background or an obstacles there that is physically present that can now predispose the individual to more pain, to more suffering, since we don't want to do more harm. So in as much as we have ruled those one out, the hypnosedatives is one of the things that we can use to calm the individual down. And when we have successfully calmed the individual down, then other form of treatment will go based on what we found. Psychotherapy will work based on the background diagnosis that we have found as a differential now in the psychological realm. So if you find other differentials that are there, then psychotherapy will be tailored to meet the specific differential, the diagnosis that is made. So if the anxiety symptoms that are found and a specific or a particular anxiety disorder has been diagnosed, or if it is a depressive illness or a manifestation and other emotional problem that we'll look at, then all this will be tailored. That's why the psychotherapy will be tailored to meet that. So it won't just be psychotherapy that is just broad or just overflowing just like that. That will be looked at. So psychotherapy will play its own role there to be help the individual. But also, so for some people, more things might be carried out for them. Just like some might need sex education, because that may also play a role to help the individual to understand that okay, what you might be going through, this is what the situations are, this is what might be done, and this is what not to do. So the individual might also benefit more to see a sexologist. But if you come to a if you see a mental health professional, they'll be able to help you through all this at the same time while they are looking at other background illness. So depending on what is diagnosed as might be the likely background problem that suddenly dramatically presents in the bodily way for the individual rather than the psychological understanding of it, that will guide the kind of management, the kind of treatment that will be offered to the individual. I
Yes.
don't know if this
So
SF.
yes. It makes sense. So it just depends on the management of the patient, will depend on the state in which, the patient was actually met. If the
Yes,
patient is in a very highly excitable state, you may need to even give some injections to the patient, in
exactly.
addition to medication by mouth, and then of course counseling and psychotherapy in patients who have high stress, who have been perceived to have some high anxiety, anxiety disorders, or some stressors. As you mentioned
Mm,
before, if there's issues with sexual intercourse in any way, or sexual issues, then of course a sexologist might need to come in to also counsel the
yes,
patient, as the case may
yes,
be. But have you
yes.
encountered ever any cases where epidemic genital retraction syndrome, or KORO, was misdiagnosed or maybe misunderstood by other healthcare professionals? Because, as I said before, even I didn't know about it until it was being discussed in a WhatsApp group, and then I now took interest in it, and I now went to read up the literature, and that was what made me, call you to, join me for this video interview. I mean, have you come across any cases where KORO was misdiagnosed by some of us in the healthcare sector?
Your field of specialization, that's usually a referral. That's how they come to you. But if they have been misdiagnosed, then they will never be referred to us, most likely. It is when they suspect and they know, oh no, this is the right place. It is when people have the right understanding of what is happening that most likely they might refer to us. Of course, the concept of stigma is there. And people, even if some health professional knows, they will still want believe that this is a spiritual problem. Some of us have
Yes.
that habit and say, no, go and look for a spiritual solution. But instead of them to rightfully counsel the people, like you use the word, educate them well that this might be what is there, and the right type of people that can help you are the mental health professionals, are the mental health experts. But at times people don't look at it that way. They don't bring that to the fore. Rather, they mystify it more. They scare the people more, and they make them to start looking for uh, spiritual solution for a non-spiritual problem, because KORO is not a spiritual problem,
Yes.
like we know, but people
Yes.
are misguided, and they see because they is wrongly labeled. Then people will be thinking it's a spiritual problem, and they will be looking for spiritual solution. And since that's not it, they may not get the kind of help. So I've not encountered a case of misdiagnosis being referred to us. Rather, people would rather refer what they fail to even do due diligence to. They might refer that to us, and that's to happen at times. So, and in order to safeguard the challenges of that, then it's helpful and very useful to see that when we as healthcare providers or even non-healthcare provider encounter this, one of the things to do is this is social awareness too, that one of the people that will be of help is to please see a mental health professional. We don't treat madness because none of our diagnosis, we have been talking since, but we have not seriously that we are treating madness because none of our diagnosis is called madness
Solve
the old
madness.
way because of lack of understanding of what mental illness are. People try to find one word to try to describe every mental health experience, and madness is used. But we know these days we have over 300 different diagnoses that may occur, and none of them, I've not seen any of the diagnosis that is called madness. I've tried to look out for it. There's nothing like that. So that stigma that people say, if I go there, they'll say I'm mad, is just one of those misinformation and misunderstanding. And once we help people to get the right understanding, people will come forward. But I believe there's stigma over the fear of labeling, because people wrongly label people, and nobody that people that have come to us, we don't treat them for madness. They have specific medical problems, which is what we treat. We have the right understanding, we have the right diagnosis, and we give them the right treatment. And that's why they were happy that, yo, you people are the first set of people that really understood me. I've seen people like that who come, say when I want to come, they are telling me, don't go. These people will do something worse to you. And they at the end of the day, they confess, this is the best place I should have come long time ago. Yeah, the best set of people I should have seen for my own problem, because nobody understood what I'm going through. So KORO might also be in this situation, and most of our colleagues might not be willing to refer. So,
Yes.
so we hope this might change that mindset.
Yes.
So thank you very much, and
Yeah.
I've not encountered misdiagnosis on that yet.
I think we can say that the medical community, I mean, the way we have responded, I think, in various ways, because while I was asking around about, I was asking our colleagues about experiences with KORO. Some of them, especially in the primary healthcare setting, had actually come across KORO cases in the community, and some of them hadn't heard of it before until they came. And yes, some of them admitted that yes, some of them they felt were due to spiritual reasons, because yes, we're still African, even though we have the scientific basis of many health conditions. Sometimes when we can't explain something, we just naturally just attribute it to spiritual causes. So yes, we can say that some of the reasons why probably you've not come across some misdiagnosis is because, well, some healthcare professionals might not have been able to diagnose it, and probably just allayed the fears or the anxiety of the person, referred them back home maybe, and then probably giving them maybe some sedative or something to allay their anxiety, and then send them back home after examining them and finding out that, oh, look, the penis is actually there. Maybe it was just anxiety. Probably they didn't even know that
Yes.
it has a name. They might just think it's just an anxiety thing, probably because of some social issue. And so they might not have thought it proper to, or needed to refer to a neuropsychiatrist, like yourself. So I think, am I right to say that there have not really been any breakthroughs in the treatment, of KORO? Bearing in mind, as you mentioned, it's mainly medication, psychotherapy, counseling.
What I'm saying is that KORO on itself is not a diagnosis. It just it just one of the bodily manifestation of an underlying problem, just like one of the symptoms of an underlying problem. And it is when the individual come that we can make the right diagnosis and we treat what the background problem is. Because without that, they will have not helped the individual, because we are just trying to play to the sensationalism, also trying to play to the gallery. No, KORO, most of the way it has presented, they are just a manifestation of a background problem. And that's why I've said that it might be in the anxiety spectrum, any emotional problem that might be there, any form of anxiety problem. It might be depression, it might be mania, manic problems, or it might be in the psychotic spectrum. And also, it can occur in people, even in the elderly, who are experiencing some form of dementia, especially the Alzheimer types. In the period of lucidity, they may feel that, oh, something has happened to my genitalia. And because of old age and the weather condition, and they can also raise alarm on that. So it can occur in most of the psychiatric illness that might be. It might occur in other dissociative problems. So it can occur in so many, like I also say, it can occur in some physical illnesses too. And it can even be, it can might not be disease related. It might just be due to lifestyle problem that people might be encountering. So all this idea, it is by getting what is the background problem that we treat the background problem, and that help the people to overcome this challenge that may come up. So KORO, the way it is presently, are just like symptoms of the background problem that the individual is going through.
Yes. So, I mean, as you talked about before while we were discussing KORO, that a lot of the examples that we've seen of KORO manifestations has been on the media, social media, newspapers, radio, television reports, and of course, yes, it's a culturally influenced belief or fear. So, I mean, so sometimes it might be a bit difficult to understand because sometimes, as you mentioned before, you see some video footage of people admitting to actually stealing a person's genitalia and selling off to somebody else for ritual purposes in exchange for money. So, sometimes, people might not be able to get their head around it, because they might be like, well, it is said that it is it's a manifestation of a psychological, condition. But how come this man that I'm seeing in this video is actually admitting to stealing somebody's private parts in exchange for money?
Uh,
That's the thing I need to say about that.
this may not be the first time that people might accept and agree to crime that they did not commit. There may be many reasons for people to play to the gallery, or to accept such a thing. We know under extreme stress for them to, they can agree and accept things that they didn't do. We also know there are some other psychological problems, some psychiatric diagnoses too, where people can have this kind of abnormal beliefs, and that they can also have, and they can also share it with somebody that may be close to them. Like that video that goes around, two individuals that claim this. So one of the individual might be having a psychotic belief of that, and is able to share that belief with somebody else, which you call the foliative. I'm sure all those terminology you still remember the three psychiatric training in medical school. So those things are there. It can be shared by two people. It can be shared by more than two people, where multiple can be. So those kind of things are possible for people to do. And often we may not see all that representation of it until a professional comes and look deeply at it, and they be able to bring out, oh, these are some other problems that are in the background for these people that claims to this. So there may be a psychiatric reasons for those people to claim to be that, because they have some shared belief, some shared delusions they have, and those beliefs are false, but for them is true, and it may be culturally plausible, but we know it's culturally uh, challenging for people who actually do that, that will come up to own up to that. And also, and you can see some of the report that came up, that when the police actually investigated, more than 95% of all the cases of missing penis are just false alarm.
Yes.
They are
In fact,
false
some people
alarm.
are even using it to defraud people. Some people are,
Yes,
using this epidemic to their advantage. Some people
yes,
actually are defrauding people,
yes,
because when a person has been accused, of forcibly stealing a person's penis, and they jump on the person, and then some people use it as an excuse to now steal the person's belongings, while other people are
exactly.
attacking that person, other people are stealing, stealing his
Exactly.
items, his pockets, so to speak. So it's quite
So
unfortunate.
yeah, the false alarms are there, but when the actual cases are there, it may fall into what we have tried to describe so far. That there may be some background reason why the reader go through that. I am hoping that as people look at this, they should be able to understand the difference between those false alarms, which are the majority, and the actual cases that we have described. And also those who are trying to market that they have some supernatural ability. Because for some, apart from those that may have some psychological shared delusions that they are there carrying around, some people also want to use it as a means to advertise that they have supernatural ability, that we can steal people's penis. And if you're interested, please contact me. Just like the story of the albinos, where people believe you get their hair, you get some part of their body, they can use it for money rituals, which we
Yes.
know and are very troubling, to subject people to this kind of inhuman situation and try to maim them, even kill them at times for this. And people have been killed because of this wrong belief, because they are looking for quick money, they are looking for spiritual money in quotes, which never materializes. But people believe in that, and all this have one role or the other to play in the deception that goes on. But so it's very vital for us as professionals to have this range of view to it, so that it can guide us and not make us just to jump into it and let us be carried away. So when we see genuine cases, we should please refer. It is going to be helpful for them.
That's the aim of this interview, actually, to educate not just
Thank you.
health workers, but other people too, so that when they happen to be in a situation where they're faced with KORO, they can adequately advise, or refer to
Yes.
the appropriate institution where they can adequately manage a person that's going through
Thank
this.
you very
Yeah,
much.
I mean, these are cultural stigmas and misconceptions, I mean, surrounding epidemic genital retraction syndrome or KORO, they really affect our diagnosis and our treatment.
That's true.
I'm sure it's for those for those being counseled and undergoing treatment with medication. It must be tough, bearing in mind families believe so much in these cultural norms, the beliefs that yes, somebody has actually harmed you, and that is why a person is behaving in such a manner, or saying
That's
that
true.
their genitals have been stolen. So apart from the preventative strategies, I mean, like public health initiatives that psychiatrists, that your association is doing in order to reduce the incidence, of KORO in Nigeria. Apart from the public health education, are there any other ways that are there any other things that are being done to educate people about epidemic genital retraction
Uh,
syndrome?
like you have brought out the most very vital part of it, which is preventive, and that's the primary prevention. But so and education, education, education. I think is the key. You are doing a good job on that. Thank you for bringing this up. But it's also that I hope that this will not only be an educational purpose just for few people who watch it and keep quiet. I'm hoping that those people too will take the message to other people. So by doing that, it helps to the education to really spread, and so that people can have the right form of information, and that will help them to have the right understanding, so that when there are challenges, they will actually seek help. They'll have the right understanding. They will not be misinformation or a malinformation that they will wrongfully label in their own way, and that will make them to be looking for a wrong treatment. So I hope this education will play a role in that. Another thing is that just like you're doing, this is a media, a forum that is there. You have this platform are using for it. I hope other platform owners too will use the similar things to spread the message, to help people to be able to appreciate that this is the reality and this is what we need to do. And I hope the major stream, the traditional media, they are the major, they have larger white space. We also do same, because when they participate in dispelling the myths that surround this genital retraction syndrome, the missing genital syndrome, if they play their due diligence in it, this will go a long way to help the community, so that we can help to sanitize the false information that's related to it. That people may not experience it, that's not true. People must still experience it. But would the people get the right help at the end of the day? Yes, people will get the right help, because that is what we hope to do. That is what we hope to achieve. So at the primary level, which is what you're doing, is very good and it's great. At the secondary level, which is part of what we have discussed, people that do present for treatment, the first responders who are seeing them, who are there as any health worker that is there at that level, should also have in mind that these people need referral. They need referral in order to help them. So it's not just only to dispense them, but to refer them to the right form of professionals. So if they are in doubt, they should just send them to a bigger hospital, so that hopefully they will get the right kind of professional there in that big hospital that can offer the help, which is where at the tertiary level the mental health professionals are there, mental health experts are there, and they will be able to go to the roots, so that they can help these individuals, so that they can understand what is the background suffering, psychological suffering they're going through, so that it can help them to live a more productive life. Because for people who lay claim and they find it to be genuine that they have genital retraction, actually, they might not get the right treatment. So their background problem is still ongoing, and that has not been addressed. Even when the genital reemerges again, which it does, it's come back to, and it does its function again, but yet the background problem has not been resolved. And it just means that the individual likely of re-experiencing that is there, or having a much more serious manifestation is there, and the individual doesn't want to die, but suicide might come along the way too, not as a result of KORO, but as a manifestation of that background suffering that has missed up the opportunity to diagnose, has been missed because of lack of the right referral, and that might have contributed to why an individual might take his or her own life.
Yes, so we cannot overemphasize the role of family and community support in the treatment and
Definitely.
recovery process. Because, I mean, you can imagine some reports have even said that in a bid to make sure that the man's penis goes back to its normal position, they even expose such men to prostitutes or, women of questionable character in order for the man to for his penis to go back to its normal state, so to speak. So you can imagine some of those harmful behaviors that the community actually endorses. So the role of the family, the role of community support in the management of these patients, I mean, it can't be overemphasized, even in the recovery process. It must be
Definitely.
trying to educate the community. But then how do you address the potential for relapse? I mean, in patients with epidemic genital retraction syndrome or KORO?
Yeah, it has been what you have been recalling also as well. Uh, everybody, when everybody plays their role, the relapse will not be there, because once the people see the right kind of professionals, because if the right diagnosis is made of the background challenge that the person is suffering from, the background medical problem that the person might be having, or if it's just a physiological phenomenon that is going on, the individual will have the right understanding, and they will know, I don't need to follow the wrong form of uh, all this advice that people give, because they're not giving therapy, they're not giving counseling, they're just giving advice. And the advice might be harmful because it might make them to be seeking for the wrong solution to a problem, which it is not. Because when people mislabel a problem, then people will look for the solution to that problem, and that will not solve the problem. So this typically occur, and it is what I hope we'll be able to achieve with this interaction, with this talk, and with everybody that might have access to it subsequently. I hope that with time we'll be able to reduce the belief in the occurrence of this phenomenon. We'll be able to identify that what are the background suffering people are going through, and they will see the right form of professional, because that is very vital. If people have the right diagnosis, then they will get the right treatment. That is sure. Mental health
Yes.
problem has advanced a lot, and because we make the right diagnosis, we know the right treatment for what to do. And that's why when I was talking about psychotherapy, I said, no, it's not just psychotherapy. Psychotherapy are tailored for specific problems. And it is by knowing the right problem that we can give the right psychotherapy. It's not just to throw one thing around. No, there are specific problems psychotherapy is supposed to solve, and it is based on the diagnosis that is made. And it is the right professional that will make the right diagnosis so that the individual can get the right form of treatment with whichever way diagnosis that been made. I'm sure the person will get the right treatment if that diagnosis is made, and this will help to prevent reoccurrence. Because
Yeah.
once the individual get the right treatment, then reoccurrence shouldn't come. Or if it comes, the people will get treatment faster than to keep prolonging the trauma and the suffering for the individual.
So making sure we address all those comorbid mental health conditions commonly associated with KORO or epidemic genital retraction syndrome. So, but what is the prognosis? I mean, for most patients with KORO or epidemic genital retraction syndrome, and how does it vary depending on the severity of the condition? I mean, do we have mild, moderate, or severe KORO? Although you said it's not a diagnosis, it's a manifestation, of course, of some other mental health condition happening. But do we have varying levels of, manifestations of KORO?
Based on documented history that somebody has have had that for over 20 years. So if the person is still with and the person still function, the only thing just say he has a retracted genitalia. So if the person still functions, I'm not sure it's hindering the person's functionality in other area apart from his sexual health. In his sexual, so infection, that may be only part that the individual might be going through. But outside that, the prognosis should be good, because when the person have the right treatment, then there shouldn't be fear for the person to have the right treatment. I mean, there shouldn't be fear that the person will go back to full normal functioning. So the idea of you have to go to a prostitute to check shouldn't arise. If the person is married, he'll naturally be able to fulfill his marital conjugal relationship with his spouse, as with the spouse. And if the person is not married, well, I will encourage the person might be patient. Except the person felt he has other ways to do that. Or I don't know, but I felt that the individual will even know whether it is sexually active or not through so many other ways without a sexual contact. If it's for the male, there are some other tests that can be done that we call the stamp test, that the individual can have wet dreams, and that will help to know, okay, yes, because you cannot have somebody cannot have a wet dream if he doesn't have an erection. It is the people having erection that they can have wet dreams and they can have release of the seminal fluid. The same thing for the women, they'll be able to know when the nipples will come out definitely. So the many things are there that we might get wrong, but it doesn't mean that people need to expose themselves what might further give them infection, other problems, and might over bring more trouble for them in a way to try to know whether they are back to normal or not. I know that the prognosis is good when the people meet the right type of professional to treat it. The prognosis is very good, both in the short term and in the long term too, because the background problem will be noted and will be addressed. So the prognosis is good.
Yes, and luckily, I think most cases of epidemic genital retraction syndrome or KORO usually last from, let's say, a few hours to sometimes days, yes, sometimes up to 7 days. Although I read in the literature that there have been cases where it can last for many years. And of course, in those cases, I'm sure there must be some other comorbidity, some other comorbid mental health condition that the person has for it to last that long. Then I also, I mean, still while researching, the non-epidemic cases of KORO, should I say, or should I say the non-epidemic cases of genital retraction syndrome, have been documented also. There have been some sporadic cases that have been documented, I think, of course, in the United States, in Canada, and some other continents. And of course, in those cases, I read that specific mental health conditions have been attributed to those cases. Unlike the epidemic genital retraction syndrome, where you have, cases of mass hysteria, massive hysteria that
Yes.
cause the epidemics of the genital retraction syndrome. So
That's true.
is your body the association of psychiatrists in Nigeria? I think, am I right with the name?
You are very
Association
right. Of
Psychiatrists in
psychiatrists in Nigeria.
Nigeria. Are they
Yes.
carrying out any research or developments in the field of epidemic genital retraction syndrome or KORO? I mean, I know, as you mentioned before, there have been I've seen a lot of case reports, but have there been is there anything being done, at least in this our own environment in Nigeria or in West Africa or in Africa, in the sub-Saharan, African region? Are they carrying out any research in the development in the field of KORO? Are there any studies ongoing or in the works, so to speak?
Based on those few cases, some people are working on it, but that the whole association is working on it. I won't. I will say yes in the way, because with this rapid rise, the uh, the association talk about it, and they at the point it agreed that they will give some public guidance on what people should do and not to do. So, and it's also part of what encourages people like me and others who have talked at one fora or the other on this issue, that we need to all play our role. It's also from the support that we get from our professional body that we should do this. So these are part of what our professional body encourages us to do, so that we give the right form of information, we get people to the right set of understanding, and so that all this will go a long way in helping to reverse and resolve uh, both the epidemic and the sporadic cases of KORO, wherever they may occur. And like you did point out that the epidemic associated with those psychosocial stressors, the sporadic too also have their own medical stressors that may be engineering them. So they all play their own role. But what is there is that whichever be the case, then there's something that has lies at the background. Our ability to resolve what lies at the background goes a long way in order to resolve this problem, and that we will be talking about
Yes.
for
Is there any
over the course of
collaboration, or between, let's say, psychiatrists, traditional healers, religious leaders, other healthcare providers in managing these Koro cases?
because like if it's a spiritual problem, we say okay, let's collaborate. But this is not a spiritual problem. So what we just do that we are ready to educate people, give people the right form of education, so that we can collaborate on that. So that when they see people that come with that, they can guide them to get the proper understanding of what the problem is, and they can verify. If you see people who have a spiritual distress, a spiritual problem, then we can collaborate with them on that for people who have the right kind of understanding too, because not every spiritual person have the kind of understanding of how to help people overcome a spiritual distress. So if they have that, we can collaborate and work on that. And that is why it's part of mental health practice that we do have spiritual chaplains, what we call religious chaplains of major religions that are there, so that when people are going to spiritual crisis, they can help them resolve that. They can help them relieve that burden that they are going through. So that is part of the practice already. It's even, in fact, spirituality is one of those sub specialization in psychiatry for people who are interested in it. So there are things that we don't joke with. There are things that we appreciate, that we value. We are open to collaboration in as much as it's it for the right reasons and in the right place. Koro might not necessarily fall into that because we know it's not a spiritual problem, and we know it's not a supernaturally related trouble. So, because as if we want to label it, then the moment we bring them into that, we might also send the wrong signals to people, so that people might not have the right understanding. But when we are in the realm of supernatural troubles that we know the real value, then yes, we are open for collaborations. And for other mental health professionals, we are also open for collaborations. We hope, because I believe that this kind of interview taking place today, this talk is also a collaboration in order to psycho-educate the community about it. I might not have been asked to give them their best, but I want to believe that the little that we might have discussed will have been in the right understanding, the right place to help people to understand uh, the issues, that what Koro is and what it should not be, and why we should have the right way to refer people so that they can get help the right and get help on time. Because the faster people get help, the better for them.
Yes. So, what are your biggest challenges or obstacles that you have faced when dealing with epidemic genital retraction syndrome or Koro? Have there been any major obstacles, challenges that you have faced?
I won't say there are challenges because if people refer them, then we can look at challenges. Maybe what is there is that the wrong misunderstanding of what it is might have been might might worsen the background problem that people might be having. So it is good to see that we can collaborate on this. I'm happy that our security agency, the police, are also looking at it, that people should stop raising false alarm. They're looking at that, and we're open. We are always open with them to collaborate with them through forensic mental health, so that they have cases let me file. Will be of help, and we'll be able to collaborate to help people with actual cases, because some of them do present to them, and it's either they also help to direct people to the right place, or otherwise I don't know how they look at it, but they will be of great help when people present to also think that this is a medical challenge and it needs a medical understanding that can help the people to overcome whatever is the background challenge that is being manifested through this bodily experience.
Yes. So, I mean, over the years, the understanding and perception of epidemic genital attraction syndrome or KORO has evolved because, I mean, I perceive that,
That's true.
the understanding of people will just keep on getting better, I think, because, it's more what we have so much access to information now, especially because of social media. And because of
Yes.
this, because of like interviews like this, as you mentioned before public health awareness, we're able to, should I say, sieve to filter out the truth from the falsehood. We can
Yes.
figure out the sensational stories from, the real cases of Koro
Yes.
because of, the increase in awareness because of social media and other, you know, methods of education, public health education. So, but do you
Yes.
believe that there are any key research questions in the field of epidemic genital attraction syndrome or KORO that you believe needs further exploration? Do you feel that there's still more to KORO that
Oh,
needs key research questions that you think,
the key research the key research question that might be to the fore now is to have more better understanding of the background challenges, because once you have what are those background issues that might have contributed to this, then with the right set of people, including our politicians, our political figures, they can help us with every member in the community, be it family, be it a religious leader, wherever they are, based on how they have their face of influence. We can collaborate on that to see that we can give people the right kind of information. Also, further, we can collaborate on that to see that as a question, to see that people concerned when this happens, this is where to go, and also as a concern that what are the background issues? Can we find a way to reduce those background issues in the community? So that, for instance, during the epidemic, when that might be related to political situations, what can the politicians and the community do to help reduce those political anxieties, those emotionally charged things that are related to political intrigues and political outcomes, and all those things that intrigue them. These are things, are areas that we can collaborate to help reduce that burden that people might experience, because it is vital and it's very good that we should do this, because we'll be helping a lot of us to stay healthy. For instance, during the COVID-19 pandemic, is there, but there are a lot of information and misinformation, and the emotional body that comes with it, despite that there is lockdown, is very high. But it is through collaborations that people have the right way, that people can now, there are many guides. This is what to do, this is what not, this how to use this information. These are information not to bother yourself with. And the social media company and also the providers are also helping to checkmate false information that are going on about this. So these are the kind of area that collaboration can do. I know AI can also play a role, but we also need the support of those agencies that have access, that can control this, so that they will play a role in order to help reduce misinformation, and also to guide people that when they flag this up, say, if you see a mental health professional, for example, or if you see a doctor about this situation, all this may play a role one way or the other in order to help reduce this problem. And this might be a research question area that may come up, that if we're able to announce this with various sectors, including our recent digital world and understanding, all this can come together to help reduce the burden and the incidence, the prevalence of KORO as it may be, that may manifest for a background issues on the ground.
yeah, it's so interesting that KORO has become an epidemic. I mean, we know that the definition of an epidemic is a widespread occurrence of a condition or a disease in a particular community. And the way KORO is, it's such that, it's so infectious, so to speak. Once one person has experienced it, then the person close to that person, or maybe the community or people in that particular area or that community, now suddenly also believe that yes, that this is what is actually this actually happened to that person and it is real, and they now carry that belief and then now spread it to others, so to speak, and that is why
Exactly.
there's an epidemic in quotes. So we need to have the right cultural competencies when treating KORO patients, educational awareness, awareness programs. And then I just wonder sometimes, I mean, for the male patients, I just wonder how we handle the wives in situations where the men have this and maybe it lasts for longer than it should, maybe it lasts more than a few hours or a few days. I wonder how the wives handle that case, that situation psychologically, because I can imagine that it must be a very big stressor for the family concerned. And then,
I but based on this, like I said, that there will be definitely sex education, and it
yes,
is true that all this area will be addressed, and that is why when people see the right experts, that's why all this can be addressed. Because
yes,
without seeing the right expert, there will be wrong education about what the sex is about. And part of the wrong sex education is to ask people that you have to go to and see a prostitute to check this. They might not be the right form of education. But when the people see the expert and they were discussed and addressed, and that will guide the people to the right thing to do, how the spouse can be of help, and other things that can participate. I mean, be done in order to help reduce uh, the associated difficulties that might come, especially for people in a marital relationship.
yeah. And I'm happy that you talked about all those, innovative or unconventional therapies that that will definitely show some promise in treating epidemic genital attraction syndrome or KORO. And we know that, yes, as we've been talking about the huge psychosocial impact that KORO has on affected individuals and their families. It will affect it on a wide scale. It's not just a social problem. It will affect your work. It will affect your productivity, and that is why we're talking and talking and talking about it. But Dr. Tajuddin, what are the potential like long-term effects of KORO on a person's mental health, bearing in mind that that person will have most often will have some form of mental health problem? What are some of those
And
potential long effects of KORO
the
on?
potential long effects shouldn't arise if the person have the right diagnosis from the one of what is associated, what is comorbid, or what KORO is manifesting for the individual. So, because when the right diagnosis is made, the treatment is done, then the long-term effects shouldn't be there. It is when we miss the opportunity for those diagnoses, or when there is misdiagnosis, even when they do see a health professional, when there are misdiagnosis, and when there are misreferral, when some health professionals will also say, "Go, this is spiritual problem." So when all this is contribute, then yeah, the long-term implication will be there. It means that the background mental health problem have not been addressed. And once they are not addressed, they might not necessarily resolve on their own, because those background problems might need treatment. They might need one kind of assistance or the other. So it's vital that we see that we don't miss those opportunity to do the right thing. Because missing them will definitely bring more trouble for the individual. And that's why the prognosis on the long run might be problematic for such people, that the background issues were not addressed. But if they were addressed, then all this will be over. If it's those related to political issues, once the political brouhaha is down and all the stress are over, everybody try to find a way to readjust back, and since everything might look normal until there is another circle of political experience, or whichever how it might be in different circle that might come up. But once we get over all this and we're able to address them well, then there shouldn't be a kind of long-term sequelae or aftermath of what you call in this situation of individuals.
Yes. So do you think that there's any role for patient support groups in epidemic genital attraction syndrome or KORO, in KORO management or recovery? Because, for example, like in my practice, we have burn support groups. Patients that have been diagnosed, that have been treated, have been managed for burn injuries, and we form like burn support groups where they have some form of interaction with one another to share their experiences psychologically, to share some of their symptoms, you know, before, during treatment and even after treatment, after discharge from the hospital, how they cope with some of the sequelae of the burn injuries. And that helps to, educate the other members on some things that they might not know and might not have an avenue to ask because some of them are not really regular for their follow-up visits. When they have these burn support awareness groups, they can chat with one another, they can have meetings with one another, they can share their challenges in their treatment, they can share their experiences, advice, and that will go a long way. So, do you think that that can play a role in, you know, in KORO patients as well?
It's possible if we're able to gather them. I have enough number of them on this, but from our experience, we know they hardly present for treatment. But and the other way that it might look at that, if they present because of KORO, the background problem. Of course, support group can be created for people with the background problem. If there are a group of people who may be going from generalized anxiety disorder, for instance, which is something that go for chronic period of time, a long period of time that people may come, yeah, support group will be of help. So it depends on the presentations and what we have. But as at now, we don't even have those people present so that we can create such an opportunity for them. But when they are, even if they want it virtually, I'm sure we'll be able to work something out. If they don't want to come to the hospital and they want a virtual group to do that, we'll be able to create that to be of help to them. And we are sure that we'll be able to give them the right kind of psychological support to be able to do this and to be able to get the right benefits there from it interacting in such group. So if people are open to that, that would be great. And we'll be able to move forward from that to help them go through that, definitely. The other challenge that may come up is that KORO and as it is, uh, usually just a symptoms of something underground might not really form at times into what might need a support group because of the it's usually short-lived. But if you have those people that experience those chronic experience, like the situation you are brought up, yeah, it will work. But irrespective, anyone that failure has experienced this and is suffering a psychological sequelae because of that, then they should reach out. We'll be able to find more help for them, which might include support group too along the way.
Yes. So, of course, there may be issues with some patients, of course, communicating with patients who may be skeptical or probably, patients that have, further that need management for further long-term psychiatric treatment. Such patients may be skeptical and you might not see them as you would want to because even the ones that we've been seeing, it's difficult to is you don't get to see them because they're not referred or because they don't believe in the diagnosis, so to speak. They prefer to probably go for traditional treatment, prayers, and the rest. So it might be difficult, managing them long term because they don't present themselves, they don't make themselves available for the neuropsychiatrists to manage them. And I think it would be important. It would be nice to have some cross-cultural studies or collaborations, between us here in Africa and other parts of the world to better understand epidemic genital retraction syndrome or KORO. I mean, on a global scale, it would be nice to collaborate with them and then carry out some studies, apart from, of course, our own studies over here to make us understand KORO better. And Dr. Tajuddin, how do you think the mental health system in Nigeria can be improved to better address conditions like KORO or epidemic genital retraction syndrome? How do you think we can improve the mental health system in Nigeria
Uh,
to
the,
better
the
address?
mental health system in Nigeria uh, can be improved, no doubt, and that is which means the health system in Nigeria generally can be improved. All of us are aware of that. In recent time, we're experiencing a lot of loss of qualified experts in the medical fields, and so the Japa syndrome, of course, it affects all sector, but we know one sector in the Nigerian system is the health sector, where most of our qualified people are being enticed out of the country to other climes. So one of the things that may work for us all is what all of us can do and what role our decision makers can do, and everybody will play this role, not only the professionals, but also the service users, the politicians, and everyone involved will play this role, because once everybody plays this role do the needful, give people uh, the right form of incentives that they need, so that when we can stem the outflux of our professional bodies, then we have enough professional on grant that can be able to meet the, the unmet needs that are being created because of the shortage of professionals. So I will call that one of the first thing to do is to see that we stop the further efflux of our professional in all aspects of health, in all aspects. So if this can be achieved, then those that are on grant, then more can be done to see that we provide the right tool, and the government must subsidize the service that people are getting in terms of health, because health is very expensive. The government is doing a lot, but if the government can help find a way, in addition to the NHI that exists now, but NHI is catering for fewer people than what it can do, and all the other form of system that there. If there may be more way to see that people can have access, then that will also be helpful, because that way people will come and they'll be able to afford the services that's been provided, that's been rendered. In addition, also is that as professionals, we are doing our bits in the way to see that we educate people, and every opportunity we have, we try to see that we use it for that purpose, to see that we can help people as much as possible. So, but in order to be able to get the best out of this, is that we need to see that our workforce is optimal, and when we have the optimal workforce, then we also help to see that we have the right tools to work it, the right incentive, then it will be easier to collaborate with everybody, so that we can provide the best form of treatment for people and achieve the best outcome for them
Yes. So
and the country.
innovative research, innovative treatment, people being on ground, support networks, resources available to both the physicians and to the families of individuals with, KORO, making sure that the patients have access to ongoing care and support. I mean, even after they leave treatment, cannot be overemphasized. But what are your hopes for the future in terms of advancements in KORO research and treatment? Do you have anything specific apart from what you talked about?
To have a look into the future is something difficult for health professionals to do, because our work is usually an hindsight thing, because this happen and we treat. Of course, we in psychiatry, we're also there in the field of positive psychiatry, where we are trying to say how we can strengthen people, so that that can help them to reduce, uh, to increase their ability to withstand psychological burden, so that they will not succumb to it and experience the burden, or suffer from a psychological distress or disease or condition. While also, it's also possible to say how we can increase the resilience of people, so that even when they do fall sick, they can recover faster. So one of the things I may advocate is how, uh, through so many tools that we have at our disposal, and using the positive psychiatry tools, to see how we can improve the psychological resilience of Nigerians. We believe this is possible, but the resources are not at our disposal as professionals. We work more in uh, in areas, in edifices. That's where we work. We do have community psychiatry movement that we do, moving out, but that will not be enough because without the government giving us more opportunity to see that we can create more programs for the community, not just to go and treat people with the illness, but we want to see how the government will support us more so that we create those programs for people who are not sick now, people who are not ill, who are not having any conditions, so that when they are more resilient, then that will raise their well-being level and that will make it much difficult for them to succumb to life challenges so that issues that may arise because of either epidemic or sporadic may also be reduced and include which may include KORO and any other condition that might occur. So in order to succeed in that, one of the area or one of the place to go to part is with support from the government and corporate bodies and other people concerned is to support us so that we can roll out positive psychiatric interventions that will help to stem this so that people who are not going through this will be up and fit to function well, and people who might be having, they can also be have a boost so that they will not have frequent relapse and maybe they may not even have relapse at all again. So these are possibilities and these are doable, and there are evidence and research for this both across all age group that positive psychiatry do work and do succeed in that.
Yeah, so we look forward to more success stories from patients, who have fully recovered from epidemic genital attraction syndrome or KORO under all uh, under the care of mental health physicians, neuropsychiatrists. So, Dr. Tajuddin, what advice do you have for healthcare professionals who may encounter epidemic genital attraction syndrome or KORO cases in their practice?
It's just simple. They should refer. They should give first aid and refer because it will help to see that they get the best form of treatment with the referrer. But for the referrer to be successful, they need to psychoeducate them and let them know. The referrer is not to stigmatize them, and the referrer is not to label them. The referrer is to help them get the right form of treatment, and where they are likely to get it best is to meet a mental health professional.
Yes.
That would be
And then,
my advice.
yes, yes. And then I just wanted to, before I forget, the issue of community psychiatry. You know, uh, I came across documentation where I found out that globally, on a global scale, some organizations actually have sent in some professionals, some healthcare workers to deal with Koro epidemics in Africa. And I found that so interesting because, bearing in mind that we have now, and as you mentioned before, a large number of mental healthcare physicians currently practicing in Africa as a whole, not just in Nigeria, but in Africa as a whole. I think the need for people outside Africa coming to manage, epidemics that are very peculiar or that are very common in our own environment, I mean, shouldn't arise really because now we're getting a grasp of, you know, of this condition. We are now aware that, oh, we have people that are that are specialists in this field and they're aware of this condition. So there really should be no need for community healthcare workers from outside Africa, outside Nigeria, coming to educate or manage the epidemics that we're having of corona here. We should be able to mobilize our own health workers here, our own mental health care physicians to manage such, to mobilize support groups, mobilize other healthcare workers that can educate, people on corona and to advise the government on how to handle such epidemics. So,
Uh, Definitely, we are open to that, and that's why we are pleading that the government should give the right incentives to see that those professionals stays. They are trained there, and so they understood one way or the other some of the cultural needs And so they'll be able to fulfill those needs because they'll be unmet if people from outside come and they don't understand the cultural background they're coming into.
Yes.
So they'll not be able to fulfill that. So we hope government will be able to give the right incentives to help our trained professional stays and practice in the country because this will go a long way to help the system to be successful, to help the system to be productive. And we know once the security challenge to health is out of it, then the country will also grow better and will also be able to thrive and work with, play a role with other countries in the world to be able to grow and bring their best out, best performance out, so see that they can help their country to become one of move as like I want to move from the middle income country hopefully to an advanced income country. We hope this is possible, but we need that incentives and support from government to please help us retain our professionals. Our professionals are vital to our growth as a nation, and we hope the government will be able to do this for us and which will be able to play our role to support in this because our peculiarities are our peculiarities and it will take a lot more longer for people that will come from outside to be able to meet those needs, especially in terms of epidemics. That's not the time to experiment. That's not the time to come and learn all over again and to come and say, oh, these are problems. I will know. The people on ground already understood it and they will be in the best position to help resolve this.
Yes. So let me finish Aminu's story. What happened to Aminu?
Thank you.
After he raised the alarm, he said, "Oh, I was just in the mosque. I shook this man that brought out his hand to shake me, and now my penis is missing." So of course, yes, the large crowd gathered around him, and they took him. Some people took him aside, and they came back after a few minutes, and they told the crowd that yes, truly, Aminu's penis was missing. It had just disappeared. So immediately, Aminu was rushed back home to his family, where the family immediately, went to seek the help of some traditional healers who took Aminu under their care and recited some incantations, some verses from the Quran, did some du'as, that's some prayers, just to make sure that if there was any remaining there's any remaining negativity, any evil spirits around him, they could go away so that he could go back to normal, so to speak. So, of course, first day, second day, third day, there was still no improvement. Nobody mentioned or nobody brought up the fact that, oh, maybe we should carry him to the hospital to be examined. Because based on what people around had observed, yes, truly his penis had disappeared. So he was there with his family for a few more days. And after about 2 weeks, when I inquired from the family of Aminu what eventually happened, because I actually heard the story from somebody over the phone. I called that same person that told me over the phone. I inquired from them what happened to Aminu because I explained the condition of KORO to them. I had explained that they needed to go to the hospital, but of course, sometimes counseling doesn't. Counseling is a continuous process. You might not be able to convince a person or people in one sitting. So I had been talking about it and counseling. So eventually, after 2 weeks, they hadn't gone to the hospital. But when I asked again, at that last phone call, they said, "Oh, Aminu was fine now. His penis had come back to his body, and he was carrying out normal relations with his wife, and he was normal again, so to speak." So I'm sure this story is not peculiar to just me. I'm sure the viewers and you have heard varying, stories similar to Aminu's, with, similar similar symptoms, so to speak, similar symptoms, similar signs, both for the patient and for the family. And so it's important for us to know about KORO, epidemic genital attraction syndrome. Please, if you know anybody who has been affected by KORO, or you have a family member that is skeptical about it being a mental health condition, you could forward this video to them, and then they might decide to change their mind about this topic, KORO, or epidemic genital attraction syndrome. It has been called various names: the missing penis syndrome, the missing genital syndrome, so many different names. The vanishing penis syndrome, vanishing genital syndrome, massive hysteria syndrome, epidemic hysteria syndrome, so many different names. So I urge everybody to investigate more and forward this video to others for public health awareness. Thank you, Dr. Tajuddin Abiola, for gracing this interview. We've learned a lot, and we look forward to interviewing you in the future.
Thank you for having me on your platform. Thank you very much.
Thank you again. Have a good day.
And you too. Thank you.